home, we had a little more time to breathe and think, as you can many of you can remember that era of your lives. And we started looking more about climate change. And it started concerning us more than more. And then we had a flood of the Little Bighorn River in Bighorn County where we live. And at first, it was kind of exciting. The hospital was closed and the interstate was closed, and we delivered medicine to patients in boats. But then about 3 days later, the interstate opened back up. And about a week later, if you had driven from Billings down to Sheridan, Wyoming, most people wouldn't have seen any difference, like it was all over. Except it wasn't all over. And because we lived in the community and we knew the people pretty intimately, we saw that there were issues that went well beyond those 3 or those 7 days. We had people who had houses that ended up looking like this. We had people who maybe were barely getting by, a young couple with kids, and then their car got washed away and was totally destroyed, and then they couldn't get to work, and then they lost their job. And so what we found is that actually years after this flood, 5 years for sure after this flood, there were people still living in FEMA trailers, or still living in the spare bedroom of a relative, or still living in a house that looked like this. And some of them were still living in cars, 5 years later. And that was my first experience personally with climate justice. And that became, that incident was sort of a stepping stone for my husband and I, that we became much, much more concerned about climate, to the point where for the last 10 to 15 years, we've actually done this work full-time on a volunteer basis. So after all those issues with the flood, I took a bike trip. It was a fundraiser to the Arctic Circle, and raised some money for climate change, and kind of cleared my head of everything we'd been doing for the last 30 years. Went back to school to get a degree in energy policy, and then we've been doing climate change work ever since then. So I'm going to switch gears a little bit here and think about things in the air, dust in the air, like you sometimes see the cat sitting on the windowsill with the dust filtering through a sunbeam. And I always love those pictures. And I especially love the pictures of horses with stirring up dust and running, because I love horses. But let's think about this a little bit more. What we've discovered is that this dust, or other kinds of particles in the air, we call it particulate matter. And this particulate matter can come from dust, it can come from wildfires, it can come from coal and gas-fired power plants, and it can come from the exhaust of our cars. Anytime a fossil fuel is burned, it produces particulate matter. And there's some problems with particulate matter. So first of all, it's really small. When you see studies and data about climate change and air pollution, they talk about PM10 and PM2.5. So this is a human hair in the middle of the screen. And you can see that PM10, it takes about 5 or 6 of them to equal the diameter of a human hair. And then there's some beach sand over on the left. So you can see how small we're talking. And then the PM2.5s, it actually takes about 50 of them to reach across the diameter of a human hair. So they're really small. And what we found with these small things is they can go places where you don't want them to go. So in this picture, these are drawn to scale, the red blood cell that's red in the middle, and then the PM10 on your right, I hope. It looks rather inert, but it's not. Actually, the particulate matter can contain volatile acids, volatile organic acids. They can contain heavy metals like mercury, and they can sometimes even contain bacteria and viruses. But you see the PM10 is bigger than the red blood cell, the PM2.5 considerably smaller. So it only makes sense that they can probably go the same places that a red blood cell goes. And most of the red blood cells stay in your bloodstream, but not all of them. They can get out between the cells and go out into the interstitial parts of your body. And so that's actually what we found with this particulate matter. And over the last 10 or 20 years, there's been a lot of research done. And so if you look at PM10, that's on your left, and you look at where it goes in the body, it kind of stays in the upper airways. Most dust, like in those pictures that I showed you at first, is actually larger, coarser molecules. And those are the things where you breathe them in and you kind of cough and you eventually cough them out. But the PM2.5 down to PM1 are smaller, and they get all the way out into the lungs. And then the ultrafine particles, what we call PM.1, they actually go everywhere in our body. And that's where the problem comes. So what we found is that in 2019, they found the first particulate matter on the baby side of the placenta. And up till that time, we thought that the placenta was a totally inviolatable part of the body, that nothing got into the baby that wasn't supposed to be there, but that's not true. And so we actually know now that 18% of preterm births around the world are from air pollution. And in the US, it's about 3%. We don't have quite as much air pollution as a lot of places do, but it's still 16,000 babies are born premature every year because of air pollution. And so it turns out that babies are super sensitive to the particulate matter that their mother breathes. And so we actually see increases in sudden unexplained infant death, in intrauterine growth retardation, preterm birth, like I mentioned, stillbirth, some congenital heart defects, thyroid defects, and infertility is actually related to particulate matter also. And on the other side of the spectrum, with older people, like some of us on this call, air pollution has actually been linked pretty strongly to Alzheimer's disease. And air pollution, the particles of particulate matter have actually now been found in the human brain. And so when they get in the human brain, it starts creating changes in the human brain, similar, not similar exactly like we see when someone's developing dementia. So this is about as technical as my slides get. I apologize, but just the reason for this. Substances that are not from our own body, that are in our own body, are called foreign bodies, and they set off a reaction called oxidative stress. And oxidative stress does just about everything bad that can happen to a human. And so we see cancers and diabetes are related to oxidative stress. The fetus problems that we talked about, kidney problems, brain problems. It really affects the entire body. So I'm going to switch gears again, and I'm going to talk about the greenhouse effect, just really briefly, because I know most of you know that, especially because you're on this environmentally focused committee in Zonta. So when we burn those fossil fuels, they create the particulate matter like we talked about. They create a lot of toxins, and then they create the greenhouse gases that get into the atmosphere and basically are like a blanket around the Earth. And so anytime you put a blanket around anything, what's inside of the blanket is going to get warmer. And that's why the Earth's gotten warmer. And, we all sort of have a love affair with heat. I'm sure all of us, even though we know it's bad now, I'm sure we all did some sunbathing when we were kids. And we all love flowers out in the gardens. And we all love babies and blankets. And most of us probably did sports at some point, if not continuing on now in our lives, out in the sun where it's beautiful. But the problem with heat is that too much of it is a bad thing. Numbers of times when I've given a talk on climate change, people in the audience, especially people who are naysayers, will say, I kind of like it a degree or two warmer. And that's not the issue. Any day that's 75 degrees, you can have it 77, and that's not a big difference. But the problem is, if you look at this top curve, that's the blue curve, the CO2 concentrations in the atmosphere has never been this high for the last 800,000 years, as far back as we can measure it. And if you look at the temperatures pretty much parallel what the CO2 concentration is doing. And you can look and say, well, yeah, it looks like 150,000 years ago, it was warmer than it is right now. And that's true. And, back, whatever it is on here, 350,000 years ago, it was warmer. But the difference between now and then is that there wasn't 8 billion people on the Earth. And it's only been the last 10,000 years that we've had an agrarian society where we are very, very dependent on where we live and what we can grow for food. And that's where the problem lies. So heat, just like particulate matter, can do bad things to our bodies. So I had actually been doing climate change work for probably 10 years before I saw this bell curve. And any of you that had any science in your background have seen a bell curve at some point in your life. So if we surmise that this gray curve is a normal bell curve for temperature, we have some cold, we have some hot, but the vast majority of the temperatures are in the middle in that gray zone. But if that bell curve gets moved over to the right, we end up having a whole lot more hot weather. That's the red. So you see the little bit of red that's in the gray curve on the bottom. And then there's probably 6 times that much above it when we move that bell curve over. And then we have this new era of extreme hot weather that we had never had before. On the other side, we still have a little bit of cold weather. We have less extreme cold weather, but cold isn't quite as much of an issue to the human body. So let's look at that for just a minute. In Montana, with the Montana Climate Assessment and then the Montana Climate Change and Human Health Report, the prediction is that, even just 15 years from now, where a lot of us live in eastern Montana, we can actually potentially have a month more of days over 90 degrees. And again, you can survive if it's 88. Well, 90 is not a whole lot different, but that has huge influences on the entire ecosystem and on the amount of drought that we have. And we've seen a lot of drought in eastern Montana, especially in the last few years. So if we think about pregnancy, when we have higher temperatures, we've found increases in prematurity, intrauterine growth retardation, stillbirths, and birth defects. And there's actually been dozens of studies done on this exact topic. And they weren't looking at extreme heat, like when we had that heat dome out in Washington, and it was 15 degrees. They were looking at more like 85 degrees or 90 degrees for 1 or 3 or 5 days during your pregnancy. So pretty normal amounts of heat. And yet we see these significant differences in the outcomes of the pregnancies. If we look at our brains, our concentration is considerably worse with heat. So if you put students in a room where it's, again, a little bit hotter, not 115 degrees, but 85, 90, 95 degrees versus the people that are at 70 degrees, they do significantly worse on exams. And if you think about it, the vast majority of our K-12 education facilities in the United States, or at least in Montana, do not have air conditioning. Heat makes us more depressed and more irritable, and every form of aggression gets worse when it's warmer out. There's more suicides, more murders, more spouse abuse and child abuse, more fights on the streets. So heat doesn't go well with our brains. This is a kind of boring chart, but again, sort of showing you like the particulate matter, that heat affects all parts of our bodies. So when we think about it being too hot, we usually think about getting heat exhaustion or sometimes heat stroke. And that can happen, and heat stroke can be fatal. But there's not too many cases of that. But there are lots of cases of heart attacks. And when people already have heart disease, whether they know it or not, when they're exposed to heat events, they actually are significantly more likely to have heart attacks. When people have diabetes, they're much more likely to have an exacerbation of their diabetes. It puts them in the hospital. And then another concerning thing is our kidneys, because our kidneys are very much affected by heat. To the point that we've discovered a new disease in the last decade or so. It's called Mesoamerican nephropathy, which basically means kidney disease in the middle Americas, in like Central America. And what we found is that there's these young people, usually men, and they're working in the fields. They're working very, very long hours, and it's hotter now than it used to be. And when you're working in the fields, you may not want to, spend 10 minutes walking to the edge of the field to go to the bathroom, or your pay might be cut, based on your productivity for the day. So you actually don't drink as much. And what we found, as far as what we know right now, is there's about 20,000 young men with end-stage kidney disease. And if you have end-stage kidney disease and you don't have access to dialysis, like most of these people will not, you will die, usually within a year. So very, very significant effects on the kidneys. When I was in medical school many years ago, several decades ago, the concept social determinants of health, or SDOH, did not exist. They didn't exist as a category, as an acronym, but we certainly saw it. So when my husband and I went to the Indian reservation, if we hadn't seen it in residency, we certainly saw what the effects of low income were on your health. If you didn't have a car and you couldn't get to appointments, you weren't going to have as good a health. If you didn't have decent food in your community and you didn't have the money to drive to Billings 100 miles away, it was going to affect how well you were able to take care of your diabetes. So many, many things outside of the exam room affect our health. And you guys all know this. And in fact, about 3/4 of our medical problems happen outside of the exam room. So it doesn't matter what any doctor or nurse does for you. It's these things in society, and that includes our gender and our culture. So all these things affect our health. So when we talk about climate change, we talk about disproportionately affected populations. And one of those is children, but also the elderly, the pregnant, the poor, the indigenous, women, disabled people, primary job employees. Those are people that do ag or forestry or fishing for a lifetime. They're outside basically most of the time. People that live on the coast and rural populations are all considered disproportionately affected populations. So all of us on this call are at least disproportionately affected for at least one reason, if not more. I also want to note that with the exception of sea level rise, climate change is a threat multiplier. It's not the only cause of hurricanes or droughts or wildfires or extreme weather or war or famine, economic downturns, and health issues like we've just talked about, but it does increase the risk of these events or worsen these conditions. So just a couple examples here. In the early part of this century, a drought started in Syria. 60% of their fertile land turned into desert during that 4 to 5 year period. It's still desert today, and the drought is still going on today. By 2010, the drought had killed most of the country's cattle. And so what happened to all these people that were agrarian people living outside of the cities in Syria? They didn't have food, they didn't have money, they moved into the city and began a subsistence for sort of living, hoping to be able to find work or at least be given a handout of food. And if you read any of the experts in world history and economics, they all say that this was a major factor in the Syrian uprising and the Syrian civil war that's still going on today, 15 years later. The Navajo Nation had a drought around the same time. It's actually still going on today, too. And they lost a huge amount of their cows. For the Navajo, of course, they are place-based people. They place great emphasis on their livestock, and this is actually a measure of their wealth to how many cattle and sheep and goats that you have. And so to lose this, was a huge loss to their whole society. And if we get a little closer, I apologize, I didn't find out how big your District 12 is, but I know at least some of you live in eastern Montana. And about 6 years ago, we had a stage D4 drought in eastern Montana. And that's, I didn't even know there were stages of drought until then. That's the worst stage that you can have for drought. And about a fourth of all of the money that all of the farmers and ranchers would make that year, they did not make because of this severe drought. And a large number of people went out of business, basically had to close up shop for their farm and ranch, including people that I'm aware of in that area of the state. Looking on the other side of precipitation, lack of precipitation is having too much precipitation. So all of the climate change reports, they're pretty nebulous on what's going to happen with rain. And actually for most places, there's probably going to be about the same amount of rain, but what happens is that it happens in shorter periods. So you have a huge downpour or a huge snowfall, and it actually can do more damage than it does good because the ground can't absorb the water. And then because most of the storms happen in the spring and the early summer, there's very, very little precipitation in the later summer when you need it for crops, for example. And I love this picture of a storm from Montana because it shows us, what happens when we have a storm. You don't always see it this clearly in the sky, but when we have a storm, it actually draws from about 1,000 kilometers around where the storm is happening. And with the amount of increased warming that we have now, about 1.5 degrees centigrade, there's actually about 10% more water in every little square inch of atmosphere that we have. So when we have storms, there's a lot more water or snow or hail, whatever it is, to do damage. So some of that damage happens to agriculture. So this happens to be the Midwest, where they had huge flooding about 3 years ago. They couldn't even plant their crops. They lost all their grain that were in the grain bins. And they found out the hard way that all the crop insurance that they had actually didn't cover what's in the grain bins, what's already been harvested. And you might say, well, I'm not a farmer, so, that's kind of sad, but, it didn't really affect me. But it does, because that affects our food prices. So if we look at this chart, again, I apologize. I try to not have too many charts, but this is just such impressive data. In the US, on average, we only spend 6.5% of our money on our food. If you look in Europe, they spend 2 to 3 times that amount. And if you look in some places in Africa, down near the bottom of the graph, they're spending 50% of what they made. And I specifically chose this data is from 2014. It's pre-COVID, because COVID, of course, changed everything, and food prices are way up. But back then, before we had that interruption, we had these huge discrepancies in how much we spend on food. And in the US, part of the reason we only spend 6.5% of food is that there's some really wealthy people in America. So the poorer people in America are spending considerably more than that. And so if you think about with COVID spending 50% more for food, now than they were 5 years ago, that can be significant. And then when we have, again, major droughts and major weather across the world, it can affect the price of food everywhere. So another thing that happens with climate change is that we're having the sea level rise. And when the sea level comes up into our coastal areas, it affects the groundwater. And so then we end up having salinated water in that area. Nothing can grow when you have saline in the water. So the vegetation dies in a lot of these areas, but it's actually affecting our drinking water too. So they first started discovering it in Bangladesh, but actually now the same thing is happening in Florida and in other places that are low-lying and are being affected by sea level rise, in that we basically are just getting a little bit more salt in our diet. We're drinking more salt. It's not even the level that you can really taste it in the water, but it's enough that it makes a difference. Any of you that have high blood pressure, I'm sure you've had a nurse or a doctor tell you, lower the amount of salt that you eat and drink. So what they found in Bangladesh is that the women were developing more hypertension during their pregnancies and more eclampsia, which is a very serious and potentially deadly condition for both the mom and the baby. And again, we're finding the same things now in Florida with high blood pressure just in regular people, and then complications in pregnancy. Of course, the fire season has been changed. Again, climate change is not the sole cause of all the awful wildfires that we've had. We would still have wildfires without it, but we have wildfires for a lot longer during the year. They're a lot bigger because the ground is drier. We don't have the water in the late summer. So it's definitely affected the wildfires. And if we look on the coast, we have these areas where houses are falling into the ocean, and there's actually 30 communities in Alaska. They're all indigenous communities where this is happening. And again, this is happening to a place-based people who've already suffered from the historic trauma of having forced relocation, and now they're living in places that they have been in for several decades, and they're going to have to move again. And this is really, really tough on your health and on your mental health. If we switch gears again and we look at national security, it doesn't matter who was president. Over the last 40 years, there's been an enormous number of reports on national security from other countries in the world, but especially from the United States, because this does have a huge threat on national security. So if we think about that issue in Syria causing the civil war, again, there's been a lot of famine in Africa, and they're probably not going to start a world war over lack of food. But there are other countries that's certainly a potential for. So it is a real security risk. And then just a couple other things. If we think about the hurricanes, which again are not 100% caused by climate change, but are definitely worsened by climate change, we have issues like happened with Hurricane Harvey in the Houston area, where we had tons of air pollution that they allowed to escape because they just decided to let people do what they want during this time. But they also had tons of industrial chemicals that then spread out over the flooded parts of the city, which amazingly were the very poor parts of the city. So now the houses, the soils, the air, everything in those areas is contaminated with these industrial chemicals. And then to look at another aspect, the amount of work that's lost due to heat exposure because, again, we can't function as well when it's hot, and sometimes we can't work at all when it's hot. So the Lancet Countdown on Health and Climate Change comes out every year, and they look at a different aspect of the world that affects health. And this is what they chose last year, or yeah, in 24. And 500 billion hours of work lost in 2023 due to heat exposure. So because you all are interested in, especially interested in women, I thought I'd bring up a couple things about women and climate change. Women are actually 14 times more likely to die in a climate change related disaster than men. And women represent 80% of the people displaced by extreme weather. And you might ask why. And part of that is because they're already there's already inequities that affect women. So women are making less money. Women are, tend to be raising more children than men are if they're in separated households. And when disaster strikes, it's more likely women than men, not 100%, but still more likely that they are caring for the children, or they are doing childcare work, or they are doing care work for elder people. And when that happens and a disaster strikes, you are a whole lot less likely to be able to escape danger if you're having to have a child or an elder in tow with you when you're trying to escape. And so an aspect that a lot of people probably don't even think about is the amount of walking that women do to get water. So in underdeveloped countries, women are walking an average of 2.5 hours a day to get water, women and children. And about 80% of the time, it's the women and the girls. And in fact, they found that somebody's done research on it and actually found like for every half hour a day more that you're having to walk to get to water because of drought, the percentage of the number of girls less end up in school. And in fact, when you put a freshwater source into a community that previously people were walking to water, you actually find almost overnight an increase of about 15% of the number of girls that are going to school. So this just absolutely affects all aspects of our life. So what I'd like to do is stop there. I think there's still a lot of things about climate change I haven't really talked about, but I'd just like to briefly address your own health and what we can do ourselves and as a society. So first of all, think about the air quality. It really does affect our health. And so you can get the apps on your phone, you can look it up on your computer, and you really should obey these charts. For healthy adults, we shouldn't be out doing hard work when it's in the orange zone. And those of us that are elderly on the call, it's over about 55 by their definition. I don't totally agree with that, but that's what it is. We really shouldn't be doing heavy exercise when it's orange outside. If you do have to be outside, think about using a filter. In your home, think about using a filter. If you don't have an HVAC system with the right kind of filters in it, you can buy these little things in your home. You can do box fan filters, and they work pretty well. And it does make a difference, especially if you have high-risk people in the home, but even just for everybody. We don't have enough of them, but there are some cities that have clean air centers and that have cooling centers so that people who don't have access to clean air can get inside. It's actually a great project. We've done a couple in Montana where we've done box fan filter giveaways to people that can't afford to have filters in their homes. And they really do, they've been proven to help very much to clear the air in your home. So we do have these early warning systems, and we should be paying attention to them for our own health. But the other big thing to do when we have disasters, whether it's extreme weather or wildfire smoke events or extreme heat, think about checking on our neighbors. So whether we live in the city or in rural areas, there are people out there that they're gonna try to pull themselves up by their bootstraps and not complain, but they're hurting, and so check on people. So I want to just say a little bit about personal action. In general, personal action is good. It's kind of like the preacher. You don't want to see him in the bar every night. We want to see people who really accept climate change to be doing the right things. But at the same time, driving a Prius and recycling isn't going to get us out of this situation. But some personal actions do have good effects. One of them is when you put solar on your phone. It's actually the people on your street are much more likely to put solar on their home if they see that one person has it. If they see two people that have it, they're way more likely to put solar on their home. When we think about buying local and supporting small businesses, buying a gift card from downtown Billings instead of buying an Amazon gift card, supporting local businesses, and look in the cities where you live. There are refill shops in other places besides Billings, and you don't have to buy quite as much plastic that way. Those are good things to do. My daughter, who works full time and found the whole concept pretty overwhelming, she decided to pick one item a week and research it. And the first item she picked was granola bars because she really likes granola bars. So she researched to find, which ones were the more responsible companies, and used food maybe that were grown regeneratively, et cetera. So just take one little bite at a time and look at the best place to spend our money. So the other thing is our retirements. Divesting our retirement actually makes a big difference. And for some people, it can make as much difference as every other action that you do in your life to limit how many greenhouse gases you are putting into the atmosphere. Because our retirement money sits there for a long time. And so having it out of fossil fuels is a good thing. If you have any way to influence pension funds, like if you're a retired teacher or a retired nurse or retired from a particular hospital system, or you're in that system now, trying to work with them to divest their pension plan has a much greater effect because it affects a whole lot of people. Katharine Hayhoe, who, if you haven't ever listened to her, one of the best speakers I've ever heard on any topic, she says the most important thing that we can do about climate is talk about it. So talking about climate change with our friends and with our neighbors, with people we meet, is a great thing to do. And then the other thing is, when we talk about climate change, we tend to, over the past several decades, we've talked about the environment, we talked about saving the planet and saving the polar bears, and that works for some people, but it doesn't work for all people. Human health works for pretty much all people. When you come at this from a faith perspective, is if you say, I believe that we're called to care for creation, that reaches people. When we talk about economics, the fact that so many of these things are actually more economical and are better for our economy as well as our own income, those things are effective. And the most effective message of all is when we're doing things for future generations. So of course, I'm in the climate space and I'm in the health space a whole lot. It just seems like over the past 5 or 10 years that human health has really replaced the polar bear as the picture of climate change. And I think that's a good thing because, again, more people care about their own health than do about polar bears. And I apologize for this slide because nurses are actually the most trusted people in the entire United States. They've won the award for the last 30 years in the Gallup polls. Doctors are usually number 2, and pharmacists are usually number 3. So healthcare providers are actually really good people to have in this space. So how do we address these problems if what we do personally doesn't make a difference? And it's by doing things as groups, like you're doing tonight, having awareness events. And I think the most important thing to do if you think you're going to do more about climate than what you're already doing is to find your group. And that might be Zonta, or you might find that Zonta isn't doing enough on climate and you want to spend more of your time on climate. So finding a group in your area or a national group, it gives you a huge amount of support, and certainly has been critical to my survival in the last 15 years. And then find your source of renewal besides other people. And that might be enjoying the sunrises and sunsets. It might be gardening. It might be walking, getting outdoors, whatever renews your spirit, because this is tough work. So this Venn diagram was created a few years ago. And basically, you see people doing work on climate and you might say, well, I'm not a public speaker. That's fine. You don't have to public speak. And in fact, you won't be happy doing it. And so you're not going to do it for very long. Or you might say, I hate writing. So you're not going to write letters to the editor. And that's okay, because there's something for every one of us to do. And if your greatest skill and the only thing that brings you joy in life is cooking, then you can cook for events, because we always need food when we're at events. I'm just absolutely convinced that no matter what talents we have or what we enjoy doing in life, we can all put that to use in the climate movement. So think about the top of this chart, what brings you joy. Think about what works needs doing. It might be within your community or nationally or internationally. And then what are you good at? And then when you kind of mesh all those things together, you can find a climate action that you will actually keep doing and enjoy, will give you strength as time goes on. So some people have time, some have talent, some have treasure, some have all three, but whatever one of those you have, I think we can all give to the climate space. So I think one of the most effective, super fast things that we can all do is to contact our legislators. And once you have their names and their addresses or the website where you can leave a letter, you can send a letter every week to all 3 or 4, your representative and your 2 state senators. You can do that in 15 minutes, easy, maybe less than that. You don't have to write this. It doesn't have to be this beautifully written letter because really they're not going to read it very closely. What they're going to do is look at the topic you're concerned about and look at whether you're pro or con that topic. So you can send the same email every single week to your senators and your representative. And it really makes a difference. I've had legislators and Congress people tell me that they actually count up per week the number of people who call that are for gun control and who are for freedom of their guns, and for every major topic, they'll look at this. So it really does matter. And then asking people we know, people who are out in society, who are influential, to talk about climate change. Besides ourselves talking about climate change, I think those things can really make a difference. And then when we have events like the event you're having right now, and I think one of the most important things with our events is that we tell our Congress people and our legislators that we're having these events. So write to your 1 representative and 2 senators from whatever district you're in, and tell them that Zonta just did this action on climate change tonight, because there's actually. I'm more familiar with Montana than anywhere else, but there's actually a lot of actions going on, and I think most of the time the Congress people don't hear about them. And then talk with their wallet. We talked about that a little bit earlier, but buying things that you think are from responsible companies or that are responsible businesses in your town. And then if you have a store that you really love, but they're not doing, they're wrapping everything in plastic or doing whatever, talk to them about it or write a letter about it, and see if you can get any action that way, or ask your entire group to do that. So lots of times when we do actions in Billings, when we have an event, we'll have a sign-on letter, and it might be to the local IGA store, and asking them to use less plastic with their products or something like that. And whatever activities in your life you're already involved in, those are the ones where you are the best expert. It doesn't matter if you're an expert in climate change. You are a better expert than I am if you are in a particular church and you're already a member. So you're already a trusted member of that community. So if you're in other activities besides Zonta, think about ways to incorporate climate change into those areas. So for example, in churches, every denomination that I know of has materials to do a creation care sort of year-long Sunday school program for adults, for kids. Get it in your church if you're in church. In 4-H, one of my colleagues created a 4-H module on climate change. I had a friend with her daughter in Girl Scouts, and she created a Girl Scout badge on climate change. If you're a master gardener, tell them you want to hear about climate change. So again, wherever you are, you're going to be the best messenger. You're going to be trusted. And then I think it's really important to thank people and groups that are doing the right thing. And I think we all don't do that enough. And it hit me several years ago over the head because John Tester told me this, our senator at the time. And he said, and I have to admit, when I would write to people, I would save time. It's like, oh, I don't need to write to him. I know he's going to do the right thing. And so I'd write to the senator that I didn't think would do the right thing and to the representative who I also didn't think would do the right thing. But I didn't write to John Tester because I knew he was doing the right thing. He said, you need to have my back. He said, I need to get those letters just like the other people do, because then when people complain about what I can do, I can say, 49 out of 50 people that emailed me told me that they wanted me to take action on X, Y, or Z. So thank these people. And then when we do things, when we do campaigns or when we have events or when we, put up billboards, whatever, we need to use positive messaging. The Earth is going to survive. It may be without us. It may be without all the large mammals, but it's going to survive. So don't talk about saving the planet. So think about using upbeat messaging. And then I think it's a really good thing to collaborate. Again, I'm most familiar with Montana, and so many times, like in Billings, when one of us has an event, Other groups that are concerned about climate change will kind of co-sponsor the event. And basically it just gives us more publicity and we have more people coming to the events, which is a good thing. And so for some of the groups like Forward Montana or the League of Women Voters, they have a whole lot of issues besides just climate change, but they will tag on with other groups that are totally concerned with climate change. And again, it just gives us more power. And we have bigger events, which is good. So I want to thank all you all for caring, for giving up your Sunday night to do this. We're all in this together. I'd love you to check out our group. We're doing as much as we can with healthcare professionals to try and work on climate change, to try and educate people, but also to work with policy people in our state and in our country. So with that, I'll stop sharing the screen. And I'm glad it worked.
I just want to add something at the end of this because the reason I started going to Lori's group for the Montana health professionals for a healthy climate was because it tagged on to what we're doing with the AEGE committee so well that I wanted you all to be a part of that. I've attended workshops that this group has sponsored, and it talks about physicians that are doing all they can to use reusable things in the surgical areas and the OR, and it's phenomenal what different individuals can do if they really choose to do it. And everything that they do has resources. And I really loved, and I don't know if you guys can see this. Hang on, let me see if I can. But it has to do with things for children. And it says a magic school bus gets cleaned up, and it has to do with emissions. And then there's tips to protect children from environmental risks. And whoops, there we go. And it's backwards. I'm really sorry, you all. But I just want to tell you that it was phenomenal to tag on with this group because I am a registered nurse. And when I saw all the things they were doing, it was such a blessing to add that to what we're currently doing with AEGE, because it supplements it. It helps it have more body, I think. So with that, I'll shut up.
Well, thank you, Lori and Anna, and actually Liz also helped coordinate this. That was a fantastic presentation. I'm hoping everyone thinks so. Big hands to both of you. That was wonderful. So I'm going to open it up for everyone to unmute, and you can put your video on, and just if there's any questions, use the raise hand if you can. Use the raise hand button. It's under a little heart that says react. And if you click on the heart, you'll see raise hand on that, or you might just see it under like emojis or something. So, okay, Anna, you put your hand up. Very nice. Who else has their hand up? Liz. Anna, do you have a question, or can
yes,
I
go? I do, because okay. I was listening to and I noticed this when I heard the other talk too, Lori, is you talk about Mesoamerican neuropathy for young men that work out in the field in those hot temperatures that don't, hold their urine and do things like that and get kidney disease. Well, there are women that work out in fields as well, and particularly on, in the Native American population. I know that. And so have they done any studies on that? Do they know that women are affected the same?
As far as I know, most of the studies they found it in young men, but I have to admit, I have not, after the first few studies that came out about 10 years ago, I haven't kept up with it. And you're right, it has to affect women the same way. And it affects other people, not just farm workers. It's just that it was just so abrupt to have these people that are, totally healthy young people without any family history. But if you do have kidney disease, heat does worsen and can, and end up leading to renal failure.
If I can add to that, Lori, hope you don't mind, data on women and what's going on in their health and their lives relating to climate change and health and everything in between is very lacking. So there are many organizations that are trying to collect more data on that. So with that, I will go to Liz. What's your question, Liz?
Well, first of all, Lori, I could listen to you forever. Your slides were so good. I love the charts. I'm a scientist at heart. Thank you so much. I wanted to say, thank you for saying that we need to collaborate with others. I want to give a shout out to a couple of people here. We have Sean Beschler from our local AAUW. They just put on a wonderful presentation a few weeks ago that I attended on recycling, et cetera, in our community. And also from across the sea a little bit, Carmen Reyes, who is a member of my Laudato Si private group. It's an interfaith group that is environmentally concerned. So all those things are very good. And wow, what an amazing amount of information. And we haven't even touched on plastics in our bodies, et cetera. I mean, there's so much to think about. And we do have some pushback on climate change here in this district, Colorado, Wyoming, Montana, South Dakota, because we have so many people involved in fossil fuels. And so I saw an interesting little video by Arnold Schwarzenegger, of all people. And he said, if you get pushback on climate change, just start talking about pollution, because pollution is the base of all climate change as well. So that's my thing. And so my question would be, did you want to talk a little bit about plastics, even though our topic is climate today?
Uh, I had thought about it. I threw in a little bit on the talk Anna went to a couple weeks ago. I have a friend who is a master's in public health. She's an absolute world expert on plastics. She works out of Bozeman with the Cottonwood Law Firm, actually. She trained under like the grandfather of environmental medicine and pediatrics. She does fantastic talks. So I think you should have her talk.
What's her name?
Her name is Megan Wolf, and I can send the email too.
Okay,
Wonderful.
please do. You can
Thank
send
you.
it to us. Yeah, send it to Anna and Anna will bring it and send it to us. And
Okay.
that'd be lovely to have her on. Thank you. Anyone else have a question?
Well,
Go ahead, Kay.
I'm looking for the heart and the hand. One of the things we've discovered just recently is in air pollution is there's a lot of now monitoring of methane and so forth. Well, that's good and that's new. And they're discovering how much of it is in our air. But when we're looking at monitoring, nobody's monitoring, very few, there's very little monitoring of lead in the air. And it is really as bad as lead in water. Lead in air is just as bad, only the tools there aren't tools to measure it. And it's in terms of the Colorado Air Quality Commission, they haven't addressed it. So it's a kind of a new issue, if you will, but there's a lot, and when they do monitor, they're discovering really unhealthy levels. So
Yeah, so I was on the EPA Children's Health Advisory Committee for a few years, but I'm not an expert at it at all. But when they came out with the National Ambient Air Quality Standards, they call them NACs, from EPA like 20 years ago. I mean, lead and mercury were in there. And basically what they've discovered with most of the heavy metals like lead and mercury are, arsenic is another one, the levels are directly related to the amount of particulate matter, especially when you're talking about coal and gas-fired power plants. However many particulate matters they put in, you can, kind of use formulas to come up with the amounts of lead. And so everything that they do to lower the amount of particulate matter that comes out of the power plants is going to lower the lead. And it actually is way lower now than it was, 20 years ago. Although we've also discovered that any amount of lead isn't good for us. Yeah. So we keep lowering the standards of what's considered healthy. Nothing's healthy because no heavy metal in our body is good.
Yeah. One of the things they said that's certainly a climate justice issue because the polluting factors and industrialization is in areas which are the poor areas. Frankly, they're so it becomes a very regional kind of thing. It's in pockets. So
in the interstates the same way. They're going through poorer areas. Yeah. And actually all the research on infertility was done with this huge nurses study, Anna, that they did in Great Britain, and they measured how far people lived away from the big interstates. And the further you got away, the better your fertility was. The closer you got, the worse it was. It was very impressive.
I have a quick question. You talked, and I'm so grateful you did, because we've been talking about this with Zonta Says Now, but not necessarily in our district as much. You talked about the food prices as a result of climate change, which I'm very familiar with. Can you elaborate on that just a tiny bit? Because food insecurity is aligned, and water insecurity, which means not enough food, not enough water availability, really aligns with drought. So you talked about that in Syria, and we know in the global south, that's very prevalent. But do you have any information or anything you can add to what's happening in the global north? Is, US is in the global north, and we are a very large country. So I realize there's a lot of water in some places and less water in others, but it still affects us all.
Right. I mean, the problem, not a problem, but I mean, the good thing in America is that the vast majority of us have clean running water. So it's harder to measure. I mean, we know the aquifers are going down, and we know when there's less water in aquifers that the quality is affected. The Navajo that I mentioned and the people in Alaska are the one place, the two big places really in America that, you have significant numbers of people that don't have clean running water. And the food, the same thing. We produce, North and South America produce way more food than what we use, and so we're the providers for the world, and all the other places in the world don't even produce, and all the other continents don't produce enough for the people that live there. So again, we have so much excess, it's harder to see. But again, because we're so interconnected internationally, I mean, it still affects food prices and still affects the people who are already food insecure and are now more food insecure.
Yes, it seems like, well, when you have crop damage with floods going down through our Midwestern states, that means that there's less harvest. So that means there's less of something, and connecting those dots, I find is a little bit harder for people.
Yeah, I think it's harder in America for people unless you're on the lower end of the financial spectrum and you're already, struggling with being able to afford food. So.
And not to forget food deserts right in the middle of the most populated cities.
Yeah.
Well,
Right.
and that was a problem prior to the exacerbation of climate change. The last 10 years, food deserts have been going on for a long time, but now it's worse, and the food deserts are growing. So anybody else have a question? We'll take one more question. Anybody?
Well, in terms of I'm a farmer. I have a farm in the Midwest, and the farmers are going nuts regarding tariffs. And you have to make a commitment of what kind of seed and everything now, and you're not knowing what's going to happen with the tariffs and what your crop is going to be doing. So there's a lot of instability in that, in terms of food supply, and it's going to be probably a lot worse come harvest time. So I'm not sure where we're going to be with that, but it doesn't look pretty. And so I think, we're going to look back on 2024 as having ample supply, and who knows what it's going to be like in 26.
Yeah, thanks. Thanks, Kay. I mean, that's one of the biggest things in Montana. Those of us that are politically active have been working on, is getting farmers and ranchers to speak out to our Congress people that all of these, these tariffs and these ridiculous cuts. I mean, people that aren't in rural areas just don't realize that when a farm shuts down, I mean, it didn't reopen. It's gone. It's gone forever, and we've already lose so many of our small farmers. And
there's some crop insurance that's being cut too. So that's another piece, that if then when you do have a disaster, you're wiped out. So anyway.
Thank you for being a farmer.
Yes. absolutely. We had a lot of great actions that Lori talked about. I really enjoyed hearing action because we typically have a lot of information and that gets overwhelming, but then to see that there's some actions that are going on. Did anyone have any questions about the actions? Because for Zontians, there are some things that we can do with our clubs. We can talk to our local government and our local leaders to see if there are cooling centers in our communities. That's a great idea for Zonta clubs, and to probably help establish that kind of thing. Early warning systems for tornadoes and floods is a great idea for Zontians to get advocate for something like that. Advocacy is key to helping with climate action. Setting a good example as a club, using less plastic, shopping locally for your supplies, and trying not to waste food when you have food involved in any of your events. Let's see, what else did I write down? A collective action and talking about it is super important. Anna, I'll get to you next. Building awareness like we did tonight. So we will be sharing this video. I will add this, I will add a little intro at the beginning because I started the recording a little late. And not only thanking our local leaders and legislators, but also telling them what topics are important to you. So let's go to Anna and then we'll go to Liz. I see 2 raised hands.
Yeah, I just wanted to say, I wasn't, maybe because I think I'm healthy, I don't pay that much attention to air quality, that's sent out. And you just opened my eyes the last time I heard this, and now even more so, about paying attention to those charts. And if it's really higher quality, maybe we shouldn't be out walking like we do and are running without a mask, or all of those things that put our health at risk. So that was really good, Lori. I thank you for that too.
Liz?
I wanted to add, I've read so many good books in the past couple of years, but the one that has affected the most is by Carolyn Criado Perez. It's called Invisible Women, Analyzing Data Analysis in a World Designed for Man. We actually did a talk on this. We're thinking of repeating it sometime this year. It doesn't look like it's a climate book or an environmental book, but it really is. She talks about how many of our medical data are not based on women's bodies. She talks about environment, safety. She talks about everything from, plowing sidewalks so that women don't have as many injuries in Sweden, to everything, every part of our life is based on analysis in a world designed for men. And so that book, I quote from it constantly. I recommend everybody read it and try to get some men to read it too.
Thank you.
Well, I want to give a big hand to Lori and Anna. Thank you again so much. Lori, I just enjoyed every single minute of your presentation. So thank you so much. And I appreciate everyone who came today. We've had a nice group of people. Jan Landsberg said, thanks, great information. And she came all the way. She's here from Australia. She decided to tap in with us this morning. So thank you, Jan, for coming. We really appreciate you. And everyone else, really appreciate that you came. Please talk about this recording. What did you learn? And share what you learned with others. That's how we get more people to act and to build a better planet, build a better world for women and girls. So thank you so much. I'm going to say goodbye to everyone, and I appreciate you all being here. Take care, everyone.
Bye-bye. Thank you.
Bye.